Hi, it's Didrik here, and let me introduce you to Whisky. He's a West Highland White Terrier, commonly called Westies. He's a lovely boy. He's about 10 years of age, and he came in the other day for a health check, and I noticed a lump in his mouth, a lump that I'm very, very concerned about. So let me show you this lump. And Felicity will just zoom in. This is his upper canine tooth on the left-hand side, and this is the lump. Now, the area that's red, I took a biopsy from. So my question to you is, if you saw that lump, would that concern you? And a lot of you, I guess, would say, no, not really. It doesn't look horrible. It really just looks like it's a little bit of swollen gum. Well, when I saw it, I was very, very concerned. It could be one of two things. One is an epulis, and we've talked about this before, Epulis. They're totally benign, they're just a little warty growth on the gum, nothing to worry about. But what I was worried about was what's called an Acanthomatous Epulis. An Acanthomatous Epulis. If you have a look back through the videos that we've done, you'll see that my dog Jack had an Acanthomatous Epulis of a lower canine, and we removed a part of one side of his bottom jaw. Now, Jack is still around, he's fantastic, he's never had a down day from that amputation. Now, when I saw Whisky, I was concerned, very concerned as well. And he was booked in to have his teeth cleaned. That was what the routine visit was for. And at the same time, we took a biopsy of that mass. And it is an Acanthomatous Epulis. If we don't operate, it's going to overtake his whole jaw. Now, one of the hallmarks of an Acanthomatous Epulis is that it's associated with the canine teeth. And the tumour actually grows from, so each tooth sits in a socket, and between the socket and the tooth itself is a lining. A little bit like we have skin on the outside. Well, the socket, this is the skin for the socket. And the tumour arises from that skin. And so the owner and I had a long talk. His quality of life after having this removed and having the top part of his jaw on the left-hand side amputated is going to be brilliant. Most likely not even going to notice that he's had surgery. And so she's allowed me to operate on Whisky, which is what he's here for today, and help him by removing this very, very, very nasty tumour. He's got plenty of years ahead of him, and so it'd be very inappropriate to have to euthanize him in the near future because of something that can be easily fixed. So that's what he's here for today. We'll be together during the surgery. I'll let you in on what happens. If you're interested in previewing what's going to happen, have a look at Jack's video. I think that was about 12 months ago. The difference between Jack and this guy is Jack was the bottom jaw, Whisky is the top jaw. It's much easier to amputate part of the bottom jaw than the top jaw, but I've done lots of these, and typically they're very, they're ultra successful. And so we'll follow Whisky through over the next few weeks. So I'll see you in the surgery shortly. Welcome back. Here is Whisky on the table. Come and have a really good look at this mass. You can see it's not very small, but it's not very large. I've taken another X-ray, and it extends from just about here to here. So I'm going to remove this tooth and make my bone cut up there, and then we'll do it just in front of this tooth up that way, and then remove that block. I was planning to actually do it up the middle, but because that tumour doesn't extend very far, we'll leave him with a bit more bone here. Now, if you watched Orlando's video a couple of weeks ago, I explained all about surgically preparing, or prepping as we call it, the eye, and how we can't use alcohol and iodine as part of our surgical prep. It's exactly the same here. So if you remember, this is hibitane or chlorhexidine, and so Felicity's just been swabbing his mouth out with chlorhexidine like a crazy woman to try and remove as many bugs as we can. So this will not be a sterile surgery, it'll be a clean, contaminated surgery. He's already had antibiotics pre-op, and that injection will last 2 weeks. So the owner doesn't have to pop pills. He's had morphine already, he's had an anti-inflammatory already. He'll be on a morphine drip overnight tonight. All our surgical cases go on a drip, on an IV drip, especially older guys like him. So the first thing we need to do is remove the upper corner incisor, and you'll see what tooth that is in a sec. And if you remember, I did a video some time ago about my trusty periotome that removes teeth without having to do massive bone damage. Not too many vets in Australia are using one of these yet, but it saves a lot of pain and discomfort to the patient. So here we go. We're going to get stuck into this tooth. And you can see it's just like a little jackhammer. Jackhammering that down into the socket. You can see how quickly that tooth becomes loose. This is in real time. We haven't done anything extra. So we'll pause the video. It makes removal of these big teeth incredibly much better for the patient. Let's see if that's loose enough to pull out now. So that's real time, okay? I mean, I haven't got my watch on, obviously. Maybe 30 seconds. Conventionally would have taken 5, 6, 7 minutes. I'm not dressed in a surgical gown today because this is clean contaminated surgery, not sterile surgery. I will put gloves on when we actually start to do it. When we start to actually do the surgery, but for a tooth removal, we don't need to do that. Okay, so we'll switch the video off and I'll get stuck in a little bit more. This tooth's out, we're ready to go. We've draped him up. As I said, clean contaminated surgery, not sterile surgery. The first thing I'm going to do, and we're videoing this with the lights off because it causes too much reflection, so it's hard for you to see. But the lights off makes it hard for me to see. So this is really fine detail work, and I'm going to need to put the lights on to see what I'm doing. So we'll pause the video for a little while, but I'm going to make an incision to start, getting as much of this material out as I can. So I'll show you a really careful look here. I've made this incision here. So we're removing this block of bone and tooth. So I've made an incision here. I've started lifting the gum up to create the flap that's going to cover the exposed bone. And if you can just rotate, please. Thanks, Leanne. And then I've started work as well on elevating the tissues covering the hard palate. So all this black area here I have to lift up, and you can see I'm just getting a little bit into here now. As expected, it's bleeding like a crazy. Haven't hit any major palatine vessels yet. I hope I don't, but as I said, I wouldn't be surprised if I do, because they are under here and they are in the road, and we can't typically remove a piece like this without damaging one of those vessels, and that's 100% cool. At the end of the day, everything will be hunky-dory. So yep, we'll get back to it, because I need my light. I'll show you where we're up to. You might have noticed earlier that I was using the scalpel with my hands, my fingers. I haven't used a scalpel holder. This is a scalpel blade holder. I haven't used one of those for 30 years. I'm just more comfortable doing it this way. 99 out of 100 vets would use a scalpel blade holder. But I do have another use for the scalpel blade holder, and that is I use this blunt end as an elevator. So let me show you what I've been fiddling with since we last talked. That's it. I've created this flap here of the roof of the mouth, and the back end of the scalpel blade holder is a really nice elevator. I use that consistently for that. You can just let him rotate back. and then I also use it here to elevate the gum. So I'm creating quite a big flap because we're going to have a big deficit to fill up. So that's it. I'll catch up again shortly. Beavering away diligently, and as you can see here, I've got a nice large flap of gum elevated. That's going to be what I use to graft over here, and then the same on the inside. So this area's, there's bone there, so this just shells off if you're very careful. So, as I said, been diligently working away, beavering away very, very carefully, being careful not to cut anything, not to damage any nerves. And this bleeding is nothing that's been cut, it's just oozing. So we're in really good shape. We're now going to do the gory bit, which is cutting the bone with the saw, and it is literally a saw. It is a special orthopedic power saw, a special orthopedic bone saw worth many tens of thousands of dollars. It's not like a normal saw, but it is like a normal saw, if that sort of makes sense. Just a word of warning, if you're not up for blood and gore, then please skip the next few minutes of the video. Just a little friendly advice. Piece of fancy equipment here, and this is a bone saw, and that's an oscillating head. So that just goes backwards and forwards like this. So it'll cut bone, but it won't cut soft tissue. That being said, it still gets very, very, very hot, and the nurses will be cooling this whole thing by squirting sterile saline onto the blade. If we didn't do that, we'd cook the bone, everything would be hunky-dory for 2, 3, 4 weeks, but the bone would be dying. So we have to keep the bone really cool. There's interchangeable attachments on these. So this attachment then goes on here and works as it's a drill chuck, just to drill holes for the screws. This is a pin driver. So this hole here goes all the way through. So I can put a big stainless steel pin in here. This just hooks in here, and I can drive pins in. So there's quite a few attachments that we have for these things, and that's why they're so expensive. They do the same as, you know, a saw, a DeWalt saw that you can get at Bunnings or somewhere equivalent, but they have many, many more attachments. They're all and they're very specially made. And yeah, so when a vet does orthopedic surgery on your pet, you've got to, you know, and they bill you whatever it is that they bill you. A lot of people say, oh, this is crazy, you're charging me so much and you're only going to do it for half an hour, whatever. Well, this is going to take us 2.5 hours. But you know, a huge part of the cost of the surgery is these things, because they only last a certain while. You have to replace them, etc., etc. And I just wanted to show you where some of the cost goes. And like in a human hospital, you know, Medicare or Medibank, whatever it's called, pay for all this sort of stuff, but vets have to pay for this stuff out of their own pocket. And as I said, to have a well equipped hospital, you need a lot of things, and that costs a lot of money. So anyway, just thought I'd share that with you, and we'll start cutting the bone very shortly. Isolate this piece here that's got the tumour and the tooth on it. And now there's blood everywhere, as you can see, all over the glasses, the walls. That's just the way it is. It's something we have to put up with. So now it's a matter of getting some chisels to gently elevate that piece out. I'm not sure I've cut enough bone yet, but let's see what happens. You can see that piece is loose. Okay, so I have cut enough bone. So you can see how that entire piece comes off. That's exactly what I was hoping would happen. And that's it. So that's the tumour containing, let me just swab this here for a sec. So this is the tooth with the tumour. We've got complete excision, as you can see, it's totally excised there. There's no evidence of, and we'll send this away to get it looked at. There's no evidence of the tumour there. And there's certainly no evidence here. And then on the inside, it's shelled out really nicely. This is the medullary cavity of the bone. So this is where the bone marrow is. And I didn't hit a palatine artery, which is bonus. Must be a good day because it's Friday or something. So that's what we've got at the moment. That's the defect I have to cover with the bone flaps that I've made, with the gum flaps that I've made. But this is, I'm delighted with how this has gone. Have a look, Felicity, if you just want to have a look in here. There's a nerve that was leading to the tooth. So that's obviously, I'm going to have to trim that and cut that back. It's dead, obviously now. But really, really good end result. Well, we're not at the end yet, but a really, really good cosmetic result for this guy. And he'll live many more years, but let's not jump ahead of ourselves. We've now got to stitch this all up. I'm going to use dissolving sutures because, as you can imagine, getting into his mouth to get them out will be extremely difficult, so I'll use dissolving sutures. We'll come back to the video over the next little half hour or so as we're stitching up. I do need my light again for this very, very fine detail work. So we've been at this a little while now, and I've started to close up the front, or the anterior, or the rostral, whatever word you like to use, of the incision. So I just thought I'd show you what it looks like about a third of the way through. So Felicity will focus in here. So I've sutured till there, okay? I've got to do a little bit more fancy footwork here. But you can see it's coming together really well. What we'll do at the end of the video is show you what Whisky looks like, you know, from dead on, and I'll ask you to pick which side would we do, left-hand side or right-hand side, so you can pick the difference. Alrighty, time has moved on and we've finally finished all the suturing. So first of all, I'll show you what the inside of the lip looks like, and then I'll show you the face, and so you can have a look. So we'll take these swabs off here. We haven't cleaned Whisky up or anything at this stage. That's all needs to be done. So you guys are seeing this at the same time as we are, as it were. I just need to take these clamps off. So you can have a look at what that looks like from the inside. You can see that area there is missing. And then let's put Whisky. Now, as I said, there's we haven't cleaned the blood off or anything else, so you've got to imagine what he looks like once he's cleaned. But I'll put the tube back in the middle of his mouth. But from a cosmetic, maybe you can get him from the front, Felicity. But if Whisky was your dog, from a cosmetic aspect, what would you think? And my thought would be, and remember, I have a dog that we've done this to, except it was the lower jaw. But I would think if you were Whisky and looking in a mirror, you'd be very happy with yourself, considering the alternative was a cancer that was going to eat your jawbone away. And realistically, can you see a difference between the left-hand side, here and the right-hand side? Can you really see a substantial difference? He will eat normally. I can virtually guarantee you that he's going to eat dry food tonight. The first time I did one of these surgeries, I was absolutely paranoid. I remember it was a black Labrador, and this was back in the mid-70s, early 80s, and I was shocked when he ate that night. And every dog that I've done since then has, and I've done quite a few hundred now, has eaten that night. I know that I wouldn't be eating that night if this had been done to me. And Jack, when we did Jack, there was a bowl of dry and a bowl of canned food there. He chose the dry food. So, you know, these guys do really well. And the reason I'm talking a fair bit about Whisky and this procedure is that when you talk to people about, look, we're going to amputate your dog's jaw or partial amputation, that sort of thing, most people freak out, and understandably so. The alternative is euthanasia. Maybe not today, maybe not tomorrow, but certainly within a short period of time. So what I want you to think about is if you have a dog like Whisky with a lump in its jaw that needs removal, with an end result, cosmetic result like this, in my opinion, there's absolutely no reason that you wouldn't go ahead with the surgery. Whisky will go home, he'll start a morphine drip tonight. He's had some long-acting antibiotics, he's already had some anti-inflammatories. He'll go home on a drug called tramadol or Tramol, which is a type of morphine, and he'll go home on some anti-inflammatories as well. So he's going to get a double whammy pain control. I'm very, very, very strong on pain relief. We absolutely give dogs massive pain relief because they can't tell us when they're sore. And I think it's terrible to have a dog in pain and not do something about it. So we're very preemptive about pain relief. He'll come back for a checkup in about 7 to 10 days. And that's it. And we've got total tumour removal, and he's going to have a fantastic life free of this tumour. So go back to the first couple of minutes of this video when I showed you that lump in the jaw, and go and have a look at your dog. And if you've got a lump in the jaw that you can't explain, and remember, his lump was smooth, it was pale pink, it didn't look aggressive, it didn't look nasty, it didn't look cancerous, it didn't look horrible. It was just a lump. So have a look at your dog, and if you've got any lumps in the jaw, or any lumps anywhere for that matter of fact, bring your guy in and let me have a look at it. And you know, most of the time we can do something about it really, really easily. So that's the take-home message. Look for lumps anywhere. Not many people open their dog's mouth. Open your dog's mouth and have a good look. Flip the lip and have a good look, and get early attention. So I hope this has been A, interesting, and B, educative for you. If you've got any questions or queries, either post them up on Facebook, Bring the Practice, or send me an email. But that's it. See you in the next video. So this is the same evening we did the surgery. We finished surgery about 2 o'clock, and it's now just after closing, 5:15. And this is Whisky, the guy whose jaw we partially amputated, and you can see he's eating and drinking. So isn't that phenomenal? Would you have believed that you hadn't? And he's getting stuck in. Would you have believed that if you hadn't seen it with your own eyes? Anyway, that's a brilliant result. That's exactly what we wanted to see. His owner will be delighted. You know, as I said, cosmetically, now that he's awake, you know, what side have we done? Well, maybe it looks a little bit funny on the left-hand side, but it's certainly, and maybe he wouldn't win a Miss America contest or a Miss Australia contest, but he'd probably come second. Can you pick which side?
Oh, look, he's not looking happy.
Yes, he is.
Your mother missed you last night. Mum, kiss. No, I will. So he's still a bit wonky?
No. Went out for a walk.
Right.
He's had, like I said, breakfast and morning tea and dinner last night.
This afternoon?
Absolutely,
Yes.
anything you like with it. So you've got to be happy with the way that looks.
Oh, look, can you see that?
He may have some blood coming from his nose, obviously, for a little while.
Right.
But if you just lift that up. So it's still a little bit tight when all the...
Has he got sutures?
Yeah.
Yes.
Lots.
Oh, right. So they dissolve?
Yes.
But Felicity says he's got to come back for a check.
Just about 2 weeks, I'm checking.
Okay.